As I mentioned in yesterday's video, I'm going to give you a couple of ideas that I have had and that have been shared with me as we've been off from our regular routines recently, and I want to talk to you about routines for a minute. I know for me, the first day that I wasn't going into work to see patients like I usually do, it was challenging. It was difficult for me. As I got up, I felt like I didn't have a plan. I felt like I was a little lost. I have since made a routine for myself. I get up at the same time that I typically do. I have a project, I have something to do, and that has really helped me mentally and in the way that I'm approaching this difficult time. A dentist that I personally admire talked about making plans to go through charts to make sure that they're current and clear out old ones. You could perform chart audits. To me, that's going through and making sure that the procedures that are coded match the procedures that are written about in the record. Have all of the x-rays been charged out appropriately? Have the information been placed down into the chart, such as blood pressure, oral cancer exam screenings, and other things that you would want to have in your chart? Are they all in there correctly? Have your perio charts been updated like they should be on a periodic basis? Another thing that you may want to consider doing, most of you probably have your numbers in for 2019. Now might be a great time to look out and see, after I back out all of my doctor benefits, what's my overhead? Is it something that I can reduce? Do I want to look at expenses for dental supplies, lab fees, employee compensation, rent? Does it make sense for your practice? Does it make sense for where you practice, how you practice, the insurance that you take? Reviewing your insurance plans. Are they making sense for your practice? Are they not? Those are all personal decisions that you want to make, but you may have some time now. You may be able to find space to be able to go into your office and to look at those numbers, to think about what type of goals you want to have going forward, so that once we do get back to practice, you'll be able to very quickly be efficient and get back into the type of practice that you want to have.